we're going to run through 4 movements of the knee, flexion, well, really 3, because terminal extension is 0 degrees, and you really can't go any farther. So unless someone is dealing with a lot of injury, say to popliteus, or they have a tear, or an avulsion of a muscle, then they will truly not be able to extend their knee without pain. Now that's an injury situation that might require the assistance, will require the assistance of many practitioners to get them back to a place of neutral, but 0 degrees, you can't go any farther. So you really don't have an extension test for the knee. But you do have a flexion test. So again, this is 90 degrees, okay? What we're looking for in that 135 degrees is the ability to get about here without any compensation. This is about 145, but you want to get in that 135, 145 range without tilting of the hemipelvis. Now, if I go deeper into that, you're going to notice Josh somewhat go into a more lordosis on this side, but he can get heel to glute pretty easy. Now, that's pretty rare. You're not going to get that on many people without a lot of compensation, but he still goes into somewhat of an anterior tilt. So what you have to think about in terms of range is you're really testing knee extensors, which really is quadriceps. As I lengthen those muscles, they are going to have a pull directly on the ASIS. And so for Josh, I get 145 with very little resistance. There's no problem. Nice and clean, pretty easy motion with that. Now when you look at internal and external rotation, okay, so we're looking at the knee, but really we're looking at rotation of the tibia on the femur, okay? If I'm going in this direction, right, I'm going into external rotation of the knee. Right? I'm looking for about 20 degrees of range. So I'm making sure I bring my palm into the bones of the leg. I'm not turning the foot, I'm turning the tibia. So I'm grabbing here, I'm rotating, and there's some resistance there. If I'm going into external rotation, I'm getting to 20 degrees. It's not a whole lot of range, right? I want to make sure those bones point right to about here. And I mean, there's just a little bit of resistance and infield, but not much.
And that's for external rotation.
Yes, right now I'm taking his tibia and I'm turning it external.
Mm-hmm.
So if it's tight, I might be thinking of internal rotators of the tibia. In this case, primarily semimembranosus and semitendinosus, more so semitendinosus, as perhaps a muscle that's harboring some tension in that motion. Okay. All right, now I can grab across this way, and I'm doing the same measurement. I want about 15 degrees of internal rotation. Again, I can get there, but it's not without some work. This is actually more limited.
Yeah.
Is hip popped? Yeah. So we know we have some limitations in hip range. We could probably assume based off of that relationship that his knee is starting to take some of the work. That his leg muscles, thigh muscles are taking some of the work. So I would say as far as flexion goes, it's tremendously good. In extension, obviously we don't have any problems, but in the transverse plane of the tibiofemoral joint, there is some inhibition. Okay, so I want to think about hamstrings, but not in terms of opening up hip range. We haven't looked at the hip yet. Maybe there's a need for that. We don't know yet, but we do know that the distal portion of the hamstrings are probably going to be quite tight in transverse relationship. Short head of biceps, the distal portion of, so if anybody wants to come feel that, they can, but you want to make sure